Hello, everyone, and welcome to our series, Health Promotion and Wellness in MS. Our second webcast in this series is focused on an integrated approach to wellness for MS patients and care partners. Thank you for joining us. My name is Tyler, and I will be the operator for the presentation today. Before we get started, I would like to take a moment to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using any computer volume settings that you may have. On the right-hand side of your screen, you will see the text chat window. There is a large window which holds all of your sent messages and a smaller text box at the bottom where you will type in your questions. To send a question, click in the text box and type your text. When finished, click the send button. All questions that you submit are only seen by today's presenters. Your questions will be responded to in the order in which they were received and will be addressed at the end of the presentation. At the conclusion of today's program, you will be prompted to complete an evaluation. Your feedback will help us improve our future programs. We are joined today by our moderator, Marie LeGrand, Director of Education and Healthcare Relations and Grant Management with Multiple Sclerosis Association of America, and our speakers, Dr. Mary R. Rensel, Dr. Laura Kruskall, and Dr. Lucille Carriere. At this time, I would like to turn the microphone over to our moderator, Marie, for opening remarks.
Thank you. Good evening, everyone. Welcome to MSAA's live webinar with Dr. Mary Rensel, Dr. Lucille Carriere, and Dr. Laura Kruskall, entitled An Integrated Approach to Wellness for MS Patients and Care Partners. I am your host for the program this evening. This program has been made possible through educational funding from ABIHM, Bristol Myers Squibb, Genentech, and Novartis. Please consider completing a brief survey at the conclusion of the program. Your feedback is extremely important. You will have the opportunity to ask questions at the end of the presentation. We are pleased to bring you the second program in our Health Promotion and Wellness in MS series. This program will highlight the importance of wellness practices and lifestyle choices for individuals who are living with MS to manage current symptoms and long-term outcomes. We will also discuss wellness strategies for adolescents and young adults living with MS to apply as they transition to more independent care management. We will also discuss demonstration, health promotion, and goal-setting strategies for care partners to improve self-care, as well as address the benefits of medical nutrition therapy for individuals who are living with MS and provide resources to promote a healthy plant-based anti-inflammatory diet. Our first speaker for this evening is Dr. Mary Rensel. Dr. Rensel is an assistant professor of medicine at the Cleveland Clinic Lerner College of Medicine and the director of Pediatric MS and Wellness at the Mellon Center of the Cleveland Clinic. She specializes in neurology and integrative medicine, focusing on adult and pediatric MS, as well as brain health. Her work often intersects with wellness, advocacy, innovation, and strategic initiatives. Please welcome Dr. Rensel.
Hi, everybody. Good evening. I wish I could all be with you in person, but this is how it is these days. So we'll go ahead and get started. Thanks for joining us tonight. Let's go. This is for my kids and teens and their families, of course, that live with this day to day and are looking for some new resources. We call that resiliency. So, what we're going to talk about is, when a child or a teen gets diagnosed with MS, they have certain people on their team and, who is on their team and when do we call it pediatric multiple sclerosis. So when we call it pediatric multiple sclerosis is when folks are diagnosed when they're less than 18 years old. So that can be anywhere from toddler all the way to, 17 plus 11 months. So that's what we call pediatric onset MS. The clinical or the diagnostic criteria to call to diagnose, pediatric onset MS is very similar to what we look for in adults. Although depending on the age of the child, there are special tests that sometimes need to be done. If the teens are real close to 18, the testing is usually very similar to when an adult is tested and diagnosed with MS. When you talk about your healthcare team, I can't see the slide, so I'm not sure if they're going or is it me but I'll just keep talking. The healthcare team generally consists of a pediatric neurologist. A pediatric neurologist is somebody who takes care of kids and teens. They've trained as a pediatrician for 2 years, and then they do neurology training. And they learn about adult neurology and child neurology. So they've done a lot of training by the time they are pediatric neurologists. As adult neurologists, when we do our training, we also train and learn about kids, but we're mostly with adults. So we do a year of medicine, and then we do 4 years of a mostly adult neurology and some of pediatric. So those are typically at least the docs that are helping the kids and teens, and then there's always hopefully a large multidisciplinary team. So that might be a nurse, occupational physical therapist, social worker, psychologist, maybe psychiatrist, nutritionist. So we may have different people on the team depending on how the child or teen is feeling. We're going to talk about something called transitioning. So transitioning, and this is not what we hear sometimes on TV shows and movies, transitioning, but we're talking about transitioning your medical care from an dependent, we call it, so somebody less than 18, to someone who is independent, somebody 18 and over. So in medical care, when you're 18, you sign something, you don't have to sign anything, but when you're 18, you are independent. So you can make your own medical decisions, which is, different than, some things you can't do till you're 21. But as far as medicine, you're on your own when you're 18. If you still want your family involved or your caregivers involved, that's totally fine. But that's how it goes with medicine, not with all adult decisions. But okay, so we're going to talk about transitioning during your medical care. So when you're 12 or 13, it's a good time for the parents and the person with MS that lives with MS to think about, what can I learn about what this means, even what the disease is called, what your medicine is called, if you're on one, when you should take it, and tests that you need. And it's a good time when you're about 12 or 13 to start having time alone with the doctor so you can ask your own questions. And if you're not comfortable with that, or your parents aren't comfortable, or your caregiver's not comfortable with that, it's fine also to, what we would say, have the floor, which means that you can ask your own questions. Meaning, sometimes the parents will want to get all their thoughts in, but there should be time for you to also have your own questions answered. So that should start about age 12. And why would we want to do that? Well, we want to make sure that you're understanding why you have to go to the doctor, what the goals of the medicine are, and what to do, in an emergency. If there was an emergency, who to call. And sometimes I just start asking my patients, do you know my name? Do you know the name multiple sclerosis? So we just start with the basics. And then, when you hit about 16 or 18, it's time to think about the next level of knowledge that you need at that time. So that might be starting to maybe know where your medicines are and to initiate taking them on your own with the guidance of your parents or your caregiver. You may also carry your medical card, so your insurance card, and so that you're the one that carries that in your wallet or your purse, and that because you're learning how to be independent when you're at in a medical visit, and preparing for the day at 18 when you can indeed go to the doctors by yourself when you're 18. So, around 16 is a good time to set what we would call like a treatment plan. And you ask your doctor, could we sit down and devise a treatment plan and help me understand my disease. You know, of course, when you're 16, 17, you're starting to have new questions maybe about the disease and learning more about it, learning about the medicine, learning how to monitor for symptoms all on your own because maybe you're thinking about it more or you have new questions at that age. So, you know, around 16 to 18 is a good time, between 16 to 18 is a good time to have something we might refer to like an emergency plan or a medical plan. If something does happen, when should you call the doctor? Do you know the doctor's number? You know, these days with iPhones, you can have, you know, on your emergency screen, you can have your doctor's name. You could have a medical diagnosis. You could have the medicines that you're on, or you could have your allergies. That's a good way to have the information, you know, kind of in your back pocket, literally, in case anything would come up. And you would be able to know exactly who to call, or if you were visiting a friend out of town or something, you would be able to tell, you know, if something happened and you had to go to an emergency room or an urgent care, you would be able to say, you know, here's what medicines I'm on, here are my allergies, and it would be right in your phone. That would be the next step during that age. And then as a caregiver or a parent, there's also a transition plan for the caregiver or the parent. So at 12 to 14, it's good to say, you know, I'm going to let you ask a few questions, and if they say they don't have any, I really want you to come up with 1 or 2 questions for the provider, because you want to give them the floor a little bit and have them feel some autonomy, some independence in the visit, because it is about them after all, right? So we really want them to understand and feel comfortable in those settings. Then we also want them to ask some open-ended questions, you know, to the doctor or to the provider, to say something like, you know, what else can I be doing to keep myself healthy, or what else should I be thinking about? So those open-ended questions a lot of times really help us know where people are with their understanding of the disease process. And it shows us that they're very engaged and they're very interested in learning the best next thing to do. So that's a good, you know, for the caregivers and the parents out there, that's an important next step, is to let them, you know, between 12 and 14 to have the floor a little bit so they can answer and ask questions and get their answers. And then again, in the 16 to 18 range, we want the patients to be able to have some independence. Obviously, all of the medical visits they need to have an adult present with them at all their medical visits until they're 18. So somebody is always going to be there with them, but we want to give them the time to speak freely, and that would be important at that time. And then, you know, as they get a little bit older, when they hit 18, we want to talk to them about consent and privacy. So it's up to the patient, once they're 18, to consent on who should come to the medical visit with them. So if they want to have someone come with them, that's just fine. They can sign something or let us know that it's okay that their mom or dad or aunt or uncle or caregiver comes with them. That's fine, but it's up to them. If they say, no, I would like them to stay in the lobby, we have to honor their wishes once they're 18. And then when they're young adults, you know, we want to start talking to them about their next steps after high school in the setting of the medical condition. So what do they need to know? Again, they need to know what questions to ask when they're scheduling their own medical appointments. So do they know what their insurance card, do they know how to describe what their insurance plan is? So when they call, they can say, you know, I have this plan. Do you take this plan? And then you want to talk to your pediatric provider and say, I'm planning on seeing an adult neurologist. What should I bring to them? Or can you help me get a package together of my medical information so that I have that all set for the first time I meet an adult provider? So there's some preparation, and that really should start 17, 18 to get that package together. What are your medicines? What are your past medical history? To get maybe some MRIs on a CD, so that when you move to a adult provider, you have a folder or a little medical package ready so that you can explain what's happened over the years, medicines you've tried and tests that you've had. So that by the time, the patient hits 18, we want them to know the skills to be able to call a medical office, tell them their diagnosis, and ask them if they, so that they can ask the right questions about, do they see their disease state? When do they see them? How do they work it out with their pediatric provider? Will they refill their medicines? Will they see them? What do they do if there's an emergency? Should they call that office? So these are things that hopefully they've been talking about between the 16 and 18 years, so they know how to manage when they could be independent in their medical visits. And then when they're young adults, sometimes that might mean starting their first job or going into college, and there's a lot of times they need documentation for college about their medical condition and medicines that they may be on. So, we'll work with them. Sometimes they need a letter, like for the dorm, where they keep their medicines, what dose of medicines they're on. A lot of times the nursing, the student clinic wants some documentation about what condition they have, what medicines they're on, so that they can confirm that they should have those medicines in their dorm rooms. And if they need any kind of help with, someone to help take notes, or if there's any disability from the disorder, then we work with them and we make it clear in some letters of why they might need some accommodations to attend the school. So there are some issues, again, through the 18 to about 25 years, so that we are, again, reinforcing independent behaviors so that the patient, the young adult, feels comfortable calling their doctor, asking for what they need, and being able to now work with an adult provider. The exact time to move to an adult provider depends maybe on where you live and what providers are available, and maybe what medication you're on. At the Cleveland Clinic, we sometimes I see very young patients, or I'm an adult provider by training, but I also see sometimes the kids and the teens, mostly because of the medications that we use at the Mellon Center, and that we use more commonly than the pediatric providers. So there's no one rule about what age people have to transition from pediatric to adult care, but it depends on a lot of things, mostly where you live and what providers are nearby, and how the MS symptoms and is going, and what medications that you're on. But we usually want folks definitely by 21 to be moving. 18 to 21 should be really actively looking for an adult provider, because there are adult issues with MS, and those should be handled with adult providers. So I want to let you know that there is a file for download there in the center, or to the right of your screen. It says resources mentioned by me. So there's a few national centers that have helped to outline transition. So for medical care, so there's something called gottransition.org, and that's where a lot of this discussion has come from, and that has been supported by the American Academy of Pediatrics, and many national organizations have put their heads together to figure out when exactly transition should start, and then what the process is. So if you want to see more details about the transition process, I would look at gottransition.org. And then there are national centers and international pediatric MS study groups, the MSAA and the National MS Society. There's many national centers that have information about pediatric MS. Okay. So I'm going to stop there. I'm hoping you're hearing me.
We are. Thank you, Dr. Rensel. And Marie,
okay.
If you take it over from here.
Absolutely. Thank you so much, Dr. Rensel. I am honored to introduce Dr. Lucille Carriere. Dr. Carriere is a clinical health psychologist and Angie Ruvo Endowed Caregiving Chair at the Cleveland Clinic Louisville Center for Brain Health, where she works with patients and families affected by neurodegenerative disorders to promote healthy adaptation and family functioning. Please welcome Dr. Carriere.
Hello, thank you, Marie, for that wonderful introduction. I'm really honored to be here this evening to talk with you all about the support partner journey and what that looks like in navigating MS. So tonight we're going to delve into that and really thinking about this from this perspective of the support partner and really understanding the unique aspects that may be involved as a support partner, the role of MS education, and strategies to facilitate healthy communication as well as health and wellness activities. All right, so it's important first to recognize who is an MS support partner. Well, we define that role as any unpaid family member or friend who is providing informal or non-paid support to someone living with MS. And we know from large-scale studies across the United States is that about 30% or a third of individuals living with MS require hands-on caregiver assistance due to disability related to their MS, which could translate to help with dressing, eating, bathing, for example. And the majority of those support partners, they identify as spouses or romantic partners, and the vast majority typically live at home. Compared to support partners for other types of medical conditions or disabilities, we know that MS support partners typically occupy the role longer, about 13 years on average. And this really speaks to the early diagnosis typically seen in MS compared to, say, other disease states that are typically diagnosed later in life. It's also important to recognize the economic impact of caregiving and how that may affect an MS support partner. Nearly half of support partners will report reduced hours at work due to care tasks, whether that be attending a medical appointment or caring for their loved one during, say, an MS exacerbation or another type of acute illness, for example. The roles of support partners in MS is also important for us to really examine. They can vary widely, and they encompass many different types of responsibilities, depending on, say, the type of MS, as well as the disease course, the severity, and related disabilities that may come along with that. Additionally, assistance may be needed in some areas more than others during exacerbations or disease progression. So you may wear many of these hats, or you may only wear a few of them, depending on where you're at in that kind of sliver of time. The emphasis being really that the roles can change. And, in the case of MS, timing of symptoms, exacerbations can be unpredictable at times. So it can really range from, say, providing emotional companionship, helping engage them in those healthy behaviors that you hear at the doctor's appointments, to managing household tasks, providing really that hands-on assistance with those activities of daily living. Maybe you're helping them with transfers, or it may be coordinating overall their health care as well as other medical conditions, especially in instances in which cognitive or, say, memory difficulties may be more prominent. And so in thinking about the various roles that support partners may be occupying, as well as just the unpredictable journey of MS, it's not uncommon for support partners to report stress or burden related to caregiver tasks. Generally speaking, there's various MS-related factors that may contribute to a support partner's experience of stress, including how quickly their loved one's MS has progressed, their overall disability level, presence of cognitive or memory problems, as well as mood symptoms such as depression or anxiety. And given the unpredictable nature of MS, symptoms may also fluctuate, which could worsen or exacerbate that stress or burden level already present for the support partner. The support partner may also have other roles and responsibilities that they're filling, whether that be as a parent or as an employee working, that may also interfere with care tasks. So as well as the nature and the history of the relationship shared with the person living with MS, It may also be another dynamic that can complicate caregiving as well as receiving caregiving from their loved one. So all told, caregiving roles have the potential to negatively affect a support partner physically, emotionally, socially, and financially. But one unique aspect we see within MS is that support partners also may receive a benefit from being a caregiver or identifying in that role. Support partners often indicate a deep commitment and identification with that role, which could lead to those positive aspects, whether that be through healthy behavior changes or recognizing and finding benefit to the role that they assume as a caregiver. So as we transition into kind of the action-oriented strategies to empower support partners and help potentially reduce their stress or their burden, it's important we recognize that role of education, specifically MS-related education. And as we know, lack of knowledge regarding MS, whether that's symptom management, prognosis, lifestyle factors, can be associated with higher levels of caregiver burden, thereby increasing our knowledge of MS as a support partner, regardless of disability level or where your loved one may be at in their journey with MS. It can really help with several different areas, specifically clarifying expectations for you and your support partner, perhaps thinking about your partner's experience of fatigue and related expectations or limitations they may have. It may also increase your skill set to provide care. It may also address fears and questions about the future, such as how is MS going to affect family planning, long-term employability, retirement planning. And lastly, increased knowledge regarding MS can also help set each person up in the partnership, the one living with MS and the support partner, as hopefully equals in decision-making and thinking about the future. Certainly the task of learning about MS can be daunting, and as MS providers, we don't expect you to become an MS expert overnight. So this is really kind of thinking about how can you pace yourself? How can you gear your efforts to what's really relevant for you as well as your loved one? It's also a good rule to be mindful of your emotional reactions while you're learning, or conversely, how those difficult emotions that may be stoked reading about the future, whether that's fear, anxiety, or sadness, how that could be a barrier to really opening that book or checking out that website and really thinking about that. Is that an area that's worth further exploring? Also consider how you learn. There's an incredible array of MS resources at your fingertips, so think about what's a good fit for you. It may not be picking up or ordering a book online about MS. Maybe it's listening to a few podcasts on the way home from work, or maybe it's dialing into some webinars or attending some educational talks in your community. It's really important, though, to really recognize that your information needs as it pertains to MS will evolve over time as it relates to those medications and symptoms. Again, it's going to be really predicated on how your loved one, how they are navigating on their journey with MS, and really in context to that experience. So while that learning is important, the critical piece is really how does this integrate into your loved one's experience with MS? So you maybe are reading a brief article or you're listening to that webinar about an aspect of MS, but thinking about how does this apply to my loved one? So for example, asking them or thinking about, I wonder how their fatigue is most days. What tends to make it worse? What tends to make it better? Also, asking yourself as a support partner, do you have a strong sense of your partner's biggest challenges? Also thinking about, is it cognitive changes? Is it memory issues, walking difficulties, moods, symptoms, you name it. Again, that unpredictable nature of MS can really complicate this understanding, but simply having the conversation can really be powerful. And this is particularly important as we transition into discussing the power of communication along that journey of MS. Strong communication skills are really essential in navigating the challenges of MS, particularly within a relationship framework. Good communication, as we know, serves to build a strong foundation for any relationship, so it's only natural it would extend to this experience of this disease, which is now part of a partnership, regardless if that person is your romantic partner, your spouse, a parent, a child, or a friend. And really thinking about this from the perspective of how you develop a new language to talk about MS, how you talk about this disease. Depending on how long you've been living with it, both the person diagnosed, the support partner, you've likely encountered medical terminology along the way. Some of it's going to be more applicable than others, but really thinking about what's relevant for us, depending on how long you've lived with it. You may not be necessarily accustomed to asking someone about their spasticity or their tingling or dizziness on any particular day. But it really becomes an integral part of their life, and so by asking about it, it's extending empathy. It's showing them that you care, that you want to know more about it. The emphasis is really on helping one another feel supported as they talk about their symptoms, their disease experience, and your understanding of it as a support partner. So in general, openness, honesty are really key foundational aspects of communication strategies. Really thinking about and challenging yourself as a support partner to be curious. Ask those open-ended questions as we talked about. Tell me about your spasticity today. How were you? How was your walk? What did that feel like? Again, extends your empathy and deepens your understanding so you're better able to meet needs. Also be mindful of non-verbally. What are you communicating in the tone of your voice? How you have your arms open or crossed, where's your attention? Is it fully on them? Are you able to kind of really tune into them? As well, too, as much as we want to open dialogue and talk about symptoms and their experience, we want to be respectful of limits. Maybe it's a tough subject for your loved one to talk about. Maybe they're not in a place at that time they can talk about it. Also, too, thinking about the use of those good I statements that we hear about. Thinking about how you express emotions, how you open up a conversation, how you set the tone for it is really critical when you're having conversations that can be difficult. Maybe you're really worried as a support partner that your loved one isn't using their assistive devices enough, for example. That's a tough conversation, but maybe kind of using and having those conversations, you're trying to pull from those I statements. I feel really worried when you're not using it, so I'd like if that's something we could consider. Could we have a conversation about it? It's also important, too, to think about developing an MS-free zone, we call it, which is simply a time at which you don't talk about MS, right? MS is a part of your life, it's a part of your loved one's life, but we don't want it to be the full picture. There's so much more to the partnership that you share with your loved one. So having designated times, talking about it, saying, you know what, during these times, I don't really want to talk about it. Let's focus our conversation on something else. I'll let you know. Let's transition and talk about some of those good foundational practices that we know can really contribute to building resiliency as a care partner, as a support partner. You know this is going to be a long road. That's what we know about living with MS, and so we really want to focus on those activities that promote physical health, emotional health, because we know engagement in those activities can lead to improved mood functioning, functional status, quality of life. It helps keep the mood symptoms in check, as well as helps develop positive effects for your relationship. It can kind of change the dynamics between you and your loved one that you're caring for, providing assistance. Let's talk about some self-care do's. So we really want to be mindful of just those good, healthy behaviors, right? Are you getting enough sleep? What does that look like? Sometimes your sleep quantity may be impacted because you're having to engage in care tasks during the night. You know, there's some ways that we can work around that. Are you engaging in good, healthy diet? Are you eating right? Or are you using food perhaps as a way to just kind of manage the stress and the burden? And also, too, thinking about just good exercise. You know, how often are you getting out to engage in that, whether that be yoga or, you know, going outside for a walk? It can really vary. Also, too, thinking about your engagement in recreational activities, enjoyable things that you're doing. Those are all really important outside the role of being a caregiver and as a support partner, too. Social connections can also be a really vital part of your journey, engaging in self-care. Thinking about right now in the era of COVID, that's made things a little challenging as we're practicing social distancing and we're being mindful of those aspects, but thinking about video connections, whether that be through a video call or something on the computer, that can also be helpful. In addition, it's also important to have time away from caregiving tasks, thinking about how you can have some time from those, particularly the hands-on assistance that may be provided. Oftentimes those care partners can experience higher levels of caregiver stress and burden than those not providing those services, so it's even more critical to be able to have that time to step away. And working with, say, your care network to potentially facilitate that. So could that be through asking friends or families? Could you look into respite care with local community agencies? Patient advocacy groups can also be really helpful with linking you to, say, personal care assistants or respite services. And really, too, kind of taking a step back and really adopting a flexible mindset. You know, how can you kind of roll with the punches with these unpredictable journeys and challenges that MS can throw you? Really thinking about, do you have a backup plan? So you may have an event, you may have an activity, small as it may be planned, but something may get in the way. Maybe the fatigue is overwhelming, the pain is too much, it's just really not feasible to get out or to engage in the activity you planned. What's plan B? So as you're planning the initial activity, can you also have a backup just in case? You may never use it, but just having it there can be a safeguard. It provides you with a safety net. And over time, this becomes more routine for you, more out of habit. So it just kind of comes with living with some of the challenges of MS. Also, too, in thinking about engagement in those self-care activities I've talked about, really kind of being mindful of the flexibility with the duration. It can be something as short as just a few minutes. There's other ways that you can engage in these activities that's in a convenient fashion. Again, depending on where you are with your loved one's journey in MS, where you're at in your life, you may not have extended periods of time where you can attend a yoga session or go run outside or, do something with friends, for example, to kind of help reduce some stress. Maybe it's a few minutes that we kind of slide in the morning or late in the afternoon, thinking about how can you make it convenient. And really the key is regular engagement. Practice makes perfect. And so really trying to kind of fit that in so it's more regular and so it really becomes a habit. It becomes just part of your routine in order to kind of help safeguard against some of the stressors and challenges that may come living with MS, living alongside someone who has the disease. Also, too, thinking about how you personalize that self-care toolbox. Everyone's toolbox is going to have different tools in it. They're all going to vary. And so thinking about what does yours look like? What works for you? What hasn't worked? Are you open, right? The flexibility. Are you open to learning new ones? How do we navigate these ruts that are going to come along in the journey? We've talked about the importance of self-care, how to implement it. But I also, too, want to highlight, what should we be looking for? When do I know maybe I'm experiencing a little bit of a downturn? Well, first we want to be mindful of what those warning signs look like for you in terms of burden or stress. So it may be kind of some physical signs. Maybe you're feeling extra tired, you're having muscle tension, you're not sleeping as well as you used to. Or conversely, you may emotionally be experiencing more irritability or tearfulness, not as engaged as you used to be. Those are all signs that we need to talk to our doctor. We need to reach out. We need to talk to someone. Let them know what's going on. Also, too, you have ever-evolving needs along this long and unpredictable journey with MS. So kind of thinking about it in these three buckets, if you will. Do I have enough education or information about what's going on, what I need as a support partner, what my loved one is experiencing? Does it relate to skills? Is it I'm just not sure what to do when this occurs? Or is it more support? I just really need someone to listen. I want to connect with someone who may be also experiencing this similarly to help me process my emotions. Or it could be all three, but kind of thinking of those categories may be a way to kind of help organize yourself. And also, too, being able to communicate those needs, remembering those key healthy communication skills, and being able to relay those to someone. Again, whether that be your loved one and what exactly you may need, to your family, or to your own healthcare team, whether that be your primary care provider or your counselor or therapist. How are you showing that? And also, too, learning how to manage strong emotions. It's bound to happen as you're living with the challenges of this disease and what it may throw at you. And so can we learn to kind of manage and regulate those along the way to kind of keep things more manageable? We've learned how to kind of to navigate them. Now, how do we overcome some of those ruts? Well, we want to think about how we address first those emotional and those support concerns. So that may be through counseling. As you talk to your doctor, you think about a referral to a therapist, and meeting with them to really kind of target those strategies of mood regulation, emotion regulation. Maybe it's specific to your relationship with your loved one. Maybe you enjoy groups. Maybe you enjoy connecting others. And so it may be helpful to get connected with care partner or support partner groups. There's lots of virtual options available right now, which is really nice if that kind of fits with you and what it is that you may be looking for. But again, it's kind of reaching out and recognizing, I want to talk to someone. We want to normalize this. It's understandable to have these stressors, and we have ways to deal with it and ways to kind of help empower you to work through it. There also may be caregiving specific concerns that you're really having difficulties with. So this is really where turning to your loved one's healthcare team can really be critical, whether it's to discuss mobility aids, medication changes, maybe you're not sure how to catheterize somebody. How do you need to be supported? And really communicating that. What is it that's missing? How to manage a lot of different medications, for example. Support is there, and your healthcare team, we want to know that. We want to hear from you as a support partner. As we wrap up, we really want to think about our support partners as really vital in the trajectory of their loved one's journey with MS. Your role as a support partner can be physically, it can be emotionally challenging, but it can also have incredible benefits to you. And the promotion of support partner health and wellness practices, those behaviors we've talked about, are really essential when we think about the unpredictable as well as the long-term journey of living with MS.
Thank you so much, Dr. Carriere. I am honored to introduce Dr. Kruskall. Dr. Kruskall is the Associate Professor of Nutrition Sciences at the University of Nevada, Las Vegas, and also the Director of the University of Nevada, Las Vegas Nutrition Center with expertise in medical nutrition therapy, weight management, and sports nutrition. Please welcome Dr. Kruskall.
Thank you, Marie, for that lovely introduction, and thank you to our lovely participants this evening for agreeing to spend some time with us. So I'm going to speak with you about nutrition tonight, and nutrition is a very young science, and research is ever evolving to help us establish guidelines for optimal patient care. So looking at nutrition and MS research in particular, a lot has been done in an experimental animal research model. And unfortunately, there is no one animal that fully replicates MS in human beings. So if we're looking at human research in regards to nutrition and MS, it is much more limited and has shown some mixed results. So this evening, I'm going to take the current research that we have to establish the guidelines that I can give you. And in general, most of the research right now with MS and nutrition supports to anti-inflammatory eating, and that approach would be the most beneficial for disease progression to prevent that. And in particular, I'll be spending a little bit of extra time on vitamin D and omega-3 and the roles that they play in inflammation. Now, in addition to just MS, it's also important to note that healthy eating may decrease the risk of developing other chronic diseases like cardiovascular diseases and diabetes. And if you look at some of our newer research, if you have some outcomes or some issues like high blood cholesterol or hypertension, those factors may actually be associated with MS disease progression as well. So overall, healthy eating and keeping our body healthy with nutrition is warranted at this time. So I'm going to begin this evening discussing vitamin D. And just so all of you in the audience know, there are 3 handouts that are available to you. One of them is on vitamin D. There's a second handout on omega-3 fatty acids, and then a third one on fiber. So I'll be referring to the handout, and much of the information in the slides this evening are available to you in those handouts. Now, vitamin D is very important, and you probably all learned that vitamin D is important for bone health, but we also know it has a very important regulatory action on the immune system and is considered neuroprotective. And people with MS are thought to have an increased level of pro-inflammatory cytokines in our body and then lower levels of the anti-inflammatory cytokines. So we know that MS is an autoimmune inflammatory disease, and we think that vitamin D may help kind of keep some of those pro-inflammatory cells in check. Now, vitamin D insufficiency or not having enough vitamin D may increase MS susceptibility in both adults and children. And we know that based on our population studies that show that the risk of developing MS is lower in those individuals who either take vitamin D supplements or who have higher levels of vitamin D in their bloodstream. Now, if we look at vitamin D, if you have a low amount of vitamin D in your body, that seems to be associated with an increased risk for relapses, new MRI lesions, and disease progression. And again, going back to our animal research, we have quite a bit of that supporting that vitamin D supplementation helps slow the progression of the disease. Now, in humans, we have far less research, and a nice review was published in 2019 specifically looking at disability progression, and they didn't find a significant role of vitamin D supplementation in that one aspect of MS. However, we need far more research because the studies that we have been very few. And even though that one published report didn't suggest vitamin D playing a very positive role in disability progression, we do know that vitamin D still plays very, very beneficial roles in the body, in particular those that are involved in the physiology of MS. So looking at vitamin D status, if you don't know what your vitamin D level is, that is something to discuss with your physician, and it's actually very easy to measure by taking a simple blood test. And we do have numbers that are established for how much vitamin D we should have in our body, and what we want to see is a value of what we call 30 nanograms per milliliter. That's what we would consider a value that is sufficient. Now, MS patients are a little bit different, and we do feel that current guidelines suggest that MS patients might need levels higher than that 30, and levels above 50 are probably warranted for most individuals. So don't be surprised if you have a physician that measures your vitamin D levels and they want to target you somewhere between 60 to 80. Now, how much vitamin D do we need in our diet? I've given you some recommendations, and again, these are available in your handout, so you don't need to write down the numbers. So we have our recommended dietary allowances, and those are determined in individuals that are free of disease. Now, we do see that MS patients may need a little bit more than patients without disease. Now, can you get too much vitamin D? Well, actually you can, and we have established an upper limit of about 4,000 IUs a day, but some literature suggests you can go a little bit higher than that. Now, if you're not under a physician's care, it's probably a good idea to limit your vitamin D intake to a maximum of 4,000 IUs a day, unless, again, it's prescribed by your physician. Now, a physician is recommending vitamin D supplementation for you. Probably what they're going to be recommending for you is about 2,000 international units a day, and then they'll probably add another 100 IUs for every 1 point in the blood system they want to get up. So in other words, if we want to take you from 30 to 50, that's a total of 20 points. So your physician will be recommending values for your intake to help you get to that goal. Now, what about vitamin D supplementation? Vitamin D supplementation is strongly encouraged in individuals with MS, and in general, you're probably going to see doses ranging from somewhere between 1,000 and 4,000 IUs per day. Now, the nice thing is that vitamin D supplements are readily available and quite inexpensive. And again, if you're going to be taking vitamin D supplementation, please make sure your physician knows that you're going to be doing this. Now, shifting focus to another anti-inflammatory nutrient, that would be omega-3 fatty acids. And omega-3 fatty acids are essential in the diet, and that means that the body cannot make them. You must consume them. And there are 3 of these that are pertinent in the human body and that we need, and they're called ALA, EPA, and DHA. Now, ALA is an omega-3 fatty acid that we find in plant foods. And then EPA and DHA is a little bit more limited. It's found in marine algae and then certain fish that eat those algae. Now, we do think that all 3 of these, ALA, EPA, and DHA, seem to be involved in MS physiology, and getting adequate levels of these may help control inflammation and cell signaling pathways. However, the problem is that if you look at the research, it's unclear because of the limitations and the limited number of research studies that we have. A lot of the studies have been focusing on disease progression, and they haven't necessarily all come to the same conclusion that omega-3 is a magic bullet for disease progression. However, there are enough research data out there to suggest that it may play a very, very important role in keeping our whole body inflammation in check. So how much omega-3 fatty acid do we need? Well, if we look at the research requirements, generally most people need about 1,000 to 3,000 milligrams per day, and that should come from EPA and DHA. I'm going to tease that out for you in just a few moments here. Now, if somebody wishes to consume more than that, we consider that a therapeutic dose. So if someone is taking more than 3,000 milligrams per day or 3 grams per day, that might be therapeutic and might be warranted, but that person does need to be under a physician's care if they're going to be taking more than that 3 grams per day. So looking at the sources, where do we get omega-3 fatty acids from? Well, unfortunately, they're not abundant in the human diet. And if we consume those plant sources, the plant sources actually require conversion in the body to the active form, which is EPA and DHA. And unfortunately, it's a very slow process, and then a low amount of that is converted. So relying solely on plant sources for adequate omega-3 is probably not a good idea. It would be very difficult to get enough. So we need to try to get EPA and DHA in our diets. And as I mentioned a few minutes ago, the sources are very limited in that you can get these from certain types of algae and then the fish that consume that algae. And if somebody is a vegan and doesn't consume any type of fish or fish products, then they must purchase the algae form, and it's just a little bit more expensive. Now, oils that are rich in ALA, which is our plant source, they're pretty abundant. You can find them in flaxseed and canola oil, soybean oil, walnuts, soybeans, tofu. So they are pretty abundant, but remember, unfortunately, we can't get everything we need from plant sources. Now, how do we know how much we can get from the foods that we eat? Well, unfortunately, our fishes don't have food labels, and then the content can vary quite a bit. So in the handout that I've given you, I've listed several sources of omega-3 for you and the different types of fish that are rich in omega-3s. But a good rule of thumb, without even having a food label in front of you, very simple, is that the darker the flesh of the fish, the higher the omega-3 content. So if you can picture a piece of salmon, which is that nice dark color, that has a higher omega-3 content than a piece of white fish. Now, we also have lots of fortified foods on the market. You may have seen, for example, eggs that are enhanced with extra omega-3 fatty acids, and those can be quite useful as well. The only important thing is you need to read your labels very carefully, because a lot of times on the label it may only say enhanced with omega-3, but it's that EPA and DHA that you want. And it wouldn't be uncommon at all to have a very low amount of EPA and DHA. So reading those labels can be quite important. Now, what about omega-3 supplementation? Now, it's become very popular over the last decade or so, and it's considered one of the top 5 best-selling dietary supplements on the market. Now, if you're going to be considering an omega-3 fatty acid supplement, it's very important, just like with anything else, to read those labels, because a lot of times on the label you may see something, for example, that tells you that there's 1,000 milligrams of omega-3, but that may only contain about 300 milligrams of EPA and DHA. And remember, you want to target somewhere between 1,000 and 3,000 milligrams a day. So reading those labels are very important to see how much of the EPA and DHA that you're actually getting. Now, we have a lot of very clever supplement companies that do some marketing out there. So, again, be careful to read the label with the quantity of EPA and DHA and not just those advertisements on the front. For example, a clever marketing scheme is double strength. That may mean taking 2 pills, and it's not necessarily more concentrated per pill. A lot of our marketers will use claims like enhanced with extra omega-6s or extra omega-9s. Now, omega-6 fatty acids are essential in the human diet, but they are abundant in the American diet and are found very, very commonly in many of the fats and oils that we consume on a daily basis. So getting enough omega-6s is not a problem, and omega-9s are not even essential in the diet. So just beware of those marketing schemes where they put a higher price tag on something and they're adding products that you don't need, like omega-6 and omega-9. Now, one of the problems with omega-3, whether it be eating fatty fish or from purchasing a supplement, is that it does contain mercury. Mercury is found naturally in our oceans. So while we can't be 100% certain what products are mercury-free, what I generally recommend is kind of buying a big brand name. Most of our big brand name stores, the big brand names, they test their products to make sure that those are free from mercury. So checking that on the label would also be very important. And then one of the last things with omega-3, one of the questions I get all the time is it better to consume omega-3s from fish, or can I use fish oil supplements? And unfortunately, this goes back to that human research that's not really clear. Some of our research say it's better from fish, but then there are many, many other studies out there suggesting that we can get just as good of a benefit from taking fish oil capsules. Now let's look at some other nutrients in addition to vitamin D and omega-3, and I'm going to specifically talking about some fats and carbohydrates and some other food sources here. So one of the things that's been studied frequently with inflammation are the different fats, and there are lots of different types of fats in our diet, and we can categorize our fats as kind of in the pro-inflammatory category or the anti-inflammatory category. So many of our pro-inflammatory fats include things like trans fats, saturated fats, animal meat, and then some of our cheaper and processed vegetable oils are considered pro-inflammatory. Now, that does not mean you should avoid all animal products or you should avoid all oils on this side of the equation. It just means that we should be mindful in the portions that we are consuming. And when we have the ability to make some choices, choosing from the anti-inflammatory fat side. For example, our olive oils and canola oils and some of our walnut and pumpkin seeds and fish and so forth, these tend to be more on the anti-inflammatory side. So just making those choices when we have the ability to choose the quality oils over those that are more processed. Now, if we're looking at carbohydrate, there's been a lot of media attention lately given to carbohydrate and inflammation. And one of the recommendations that we emphasize is consuming fruits, vegetables, whole grains, and legumes. And the reason being is that our fruits and our vegetables contain phytochemicals, which are biologically active compounds that are good for our body. And then they also contain fiber and prebiotics, which are types of fibers that the good bacteria that live in our gut kind of live on. And then the emphasis would be then to limit our refined grains and our added sugars. And notice I'm using the word limit, not avoid. Most of our carbohydrates should be coming from those fruits, vegetables, and whole grains, but again, smaller quantities from the other. Now, there's been a lot of media attention lately with fruit sugar, which is fructose, and inflammation, and there's a lot of misinformation telling people that they shouldn't ever be consuming fruit because it's very inflammatory. And if you dig down into the science and dig deep, it really isn't the fructose alone. It's when we have fructose combined with a molecule called glucose. And when we put those two things together, it's called sucrose or table sugar. So yes, when we put those two molecules together forming table sugar and then consume and put those into our products, those tend to be more pro-inflammatory than just eating fruit itself. So eating fruit is not going to cause you any problems in normal quantities. Again, it's the processed sugars that tend to be more pro-inflammatory. Now, looking at fiber, dietary fiber is very important for health. Might help us with weight management, with blood lipids and colon health. And again, it also serves as a prebiotic in our body. So again, it serves as a fuel source for the good bugs that live in our intestines. Now, for people with MS, getting adequate fiber and fluid is actually important for regular bowel movements. So that's kind of important there. Now, dietary fiber is required on a food label, so that's important to check. And you do have a handout available to you on dietary fiber that not only lists how much fiber you should be looking for in a day, but also some great sources. So without having a food label in front of you, good sources of dietary fiber are fruits, vegetables, and whole grains. Now, the last nutrient I'll talk about this evening is sodium. And there's quite a bit of research looking at sodium and MS. And even though we want to pay attention to sodium and other diseases, we do see that research in people that are consuming more than 2 grams a day of sodium are more likely to have worsening of MS symptoms. But again, while research is limited in MS, there are many, many other health reasons to limit sodium, particularly preventing hypertension and some other cardiovascular diseases. Now, healthy adults should limit their sodium intake to 2.3 grams per day. If you have existing cardiovascular disease or high blood pressure, bumping that down to 1.5 grams per day. So paying attention to sodium is a good idea not only for folks with MS, but to prevent cardiovascular diseases as well. So where do we get sodium from? Well, table salt is one of those places. And if you look at our table salt, it's approximately 40% sodium. So a lot of people will say, well, I don't use table salt. I'm using sea salt or kosher salt or Himalayan salt. And technically, they are slightly less in the sodium content, but the reason why they're lower overall, it's the per teaspoon volume because of the large granules. So 1 teaspoon of sea salt will have a little bit less sodium than 1 teaspoon of regular table salt. Now, where else do we get sodium from? Well, the top choice or the top source is our processed foods. So my rule of thumb is that if it comes in a package or if it comes in a box, make sure you read that food label because those are the products that tend to be heavily processed with sodium. Another place that we get a lot of high sodium foods from are from our restaurants. A lot of our restaurants are in business to make our food taste good and contain quite a bit of sodium. So a really good strategy is that if we can eat whole foods whenever possible, foods that have minimal processing, that'll help us keep our sodium levels in check. So kind of some general recommendations to put all this together. One of the things to think about, I mentioned fiber and fluid for regular bowel movements. Making sure you're hydrated is important, and a good rule of thumb I like to give people is that your urine should be pale yellow to clear in color. Another visual I like to use is think lemonade, not apple juice. So your urine should be nice and clear to pale yellow. That means that you're adequately hydrated. Watching portions to maintain a healthy body weight, getting adequate vitamin D, and then supplementation as recommended with your physician, eating foods rich in omega-3 fatty acids, and again, supplementing with the guidance of your physician where necessary, watching those saturated fats and trans fats, eating lots of fruits and vegetables and quality carbohydrates each day, watching our sodium, And then finally, being cautious with supplementation in general. As I mentioned, there is a balance between supplementation that can be benefits for us and then supplementation that can be harmful or toxic. So make sure your physician knows if you're taking dietary supplements. So in summary, if you look at all of the research that we have available looking at nutrition and MS, most of the evidence points towards an anti-inflammatory eating approach. Vitamin D and omega-3 fatty acids are being studied extensively, and appears that adequate amounts of these are warranted. Now, if you look at other different diets that are on the market and marketed towards people with MS, there's insufficient evidence at the time to recommend one specific diet for everybody with MS. But again, most of the data support an anti-inflammatory or a Mediterranean-style diet that's rich in fruits and vegetables, whole grains and quality carbohydrates, healthy fats, lean proteins, and lots of plant sources. And with that, I think I will turn this back over to Marie.
Thank you so much, Dr. Kruskall, for the wonderful presentation. We have come to the question and answer portion of our program. Our first question, and this would be for Dr. Rensel. My child is 14. What should I be thinking about now before they get into adulthood? Dr. Kruskall? Dr. Rensel, I'm sorry.
Okay, can you hear me okay now? Hi, everybody.
Yes, I can.
Yes, so, okay, good. 14-year-old, yeah, so you're in that zone where it's just good to try to, have them feel a little bit independent in the visit, so that, just kind of, really encourage them to ask you at least one or two questions in the visit. Or have a little time alone with a provider so they can ask their own questions and feel like, they're really, it's them that the focus is on, not only the parents' questions, but their concerns as well. And then, of course, it's treating the disease. And so we're making sure that they're taking their medicines, they're getting their checkups, and they're getting any kind of tests that need to be done to just monitor for safety for the medicine. And then also to kind of step back and just look at them as a whole person. Are they, what other speakers have said tonight, are they exercising? Are they connecting with others? Are they eating well? Just like any 14-year-old should. So, stepping back and making sure this isn't the only focus in their life, that they have, they're involved in other things. And COVID, it all looks different, but still, to be involved, whether it be virtually or socially distanced ways, to stay connected with friends and family.
Thank you, Dr. Rensel. This question is for Dr. Carriere. I'm a care partner for someone with MS. How can I take time for myself while not feeling guilty when I'm taking time away from the person I support? MS is a big part of our lives, and I always want to be there for my loved one.
Yes, thank you, Marie. Great question. I think that's something in working with care partners I hear so very often is the guilt aspect, right? There's the recognition that I should be doing or I could be doing other activities that could help with improving my mental health and my state of mind, but there's always the fear of leaving that loved one and them being the focus. And I think it's really kind of thinking about it from a partnership perspective. And thinking about the benefits of when you are able to get away for even just a few minutes or a small activity or an outing, for example, and when you come back, what's your state of mind? Are you noticing that you're feeling more engaged, that you're more pleasant to be around, less irritable, less fatigued? Then that might be something to really kind of think about and fighting those feelings of guilt in subsequent outings or activities and thinking about I'm more present when I have those times away from my care partner or my caregiving task. I'm just a better partner. And so that might be something to kind of think about. And as well, thinking about it of, can you make it as convenient as possible? Even for just, like I said, small periods of time. It doesn't have to be an indulgent activity, but it can be something really small that you can really transform into something that can have a powerful impact for you as well as your loved one.
Thank you so much, Dr. Carriere. This question is regarding vitamin D for Dr. Kruskall. I read that the sun is a good source of vitamin D. Does that mean that I should lay out in the sun during the summer months?
Oh, that's a wonderful question. And the first thing I would answer to that is that, number one, we need to know what your vitamin D level is in your bloodstream, so seeing if you're adequate or not adequate. The only problem with that is it is true that we do make vitamin D from the sun. It is called the sunshine vitamin, and it does involve our skin and our liver and our kidneys, and if all of those three organs are working properly, yes, we can make vitamin D from the sun. The only problem is, as you know, laying out in the sun does cause skin cancer, so that is something to be thinking about, and that we want to balance having healthy vitamin D in our bodies, yet not predisposing ourselves to skin cancer. So step number one would be, of course, speak with your physician, get a blood test, see where your vitamin D levels are. And then step number two, seeing if your vitamin D levels are very, very low, and I see this a lot with my athletes, sometimes if your vitamin D levels are really low, even the sunshine is not enough to bring them up to adequate status, and sometimes we do need to pay attention to supplementation until we can get you to an adequate level.
Thank you. Going back to Dr. Rensel. My child is 18 and just started college. I want them to be independent and in charge of their care, but they are still relying on me to help them make their doctor's appointments. Do you have any suggestions on how I can help them take charge of their health care?
Yeah, it happens a lot. You know, when kids have a chronic medical condition, you know, we tend to, as parents, I'm a parent as well, and we tend to want to jump in and do things for them. But there has to be that give and take of letting them have more and more independence. So the first time, you know, I would have them on the phone, but you stay close and have them do it. I have a lot of kids myself. My own kids don't like to make the phone calls. They're so used to texting, but you know, in this case, you want them to get familiar with these kind of adult behaviors, but with support. So I think it's fair to say I'm going to be here to support you, but I'm going to watch you do this on your own. And with each new step, you know, support is fine, but and encouragement is fine as well. But it has to be. Sometimes there has to be, you know, a little celebration or a little. You know, you celebrate the victories, right? Even the little things. So if they do follow through with it, you know, a little celebration that's a new step and it was uncomfortable, but they got it done. I think that's fair.
Thank you, Dr. Rensel. So just a comment for you, Dr. Carriere. My boyfriend of 1.5 years is making dinner while I watch this webcast, and he just said this explains a lot. Kudos. So going into a question of self-care for someone living with MS, I have a hard time making time for myself. How can I find the time to engage in self-care when I have a full-time job and am simply exhausted at the end of the day?
Such a reality when you're living with MS, right, of finding the time and finding the balance between managing this disease, but also living your life and recognizing you have other roles and responsibilities that you need to tend to. And so, you know, I really heard that piece about fatigue, and really is that I'm thinking from the perspective of, you know, how you can engage in some of these self-care activities between these other responsibilities, you know, thinking, is that something that maybe you should have a conversation with your doctor about? Fatigue management can really be critical in terms of quality of life for individuals living with MS, mood symptoms, management of that. So, you know, if that's a piece that you can have a discussion with your doctor about, that might be one place to start. Another, too, is really thinking about, can you personalize some of the self-care activities we talked about? Not everything's going to be a great fit for each person, so what stands out? What's an easy kind of addition that you can make? Start with that low-hanging fruit. What makes the most sense? If it's just a relaxation and activity in the evening, perhaps that's a place to start.
Thank you, Dr. Carriere. Question for you, Dr. Kruskall. If you have Thinking about someone living with MS, what in general should not be eaten? What in general should I not drink?
Okay, so boy, that's a broad question. So in general, if I had to answer that, because that could be taking all day, I would try to, whenever possible, again, go back to the whole food. Whole fruits, whole vegetables, lean proteins, whole grains. If it comes out of a box or a package or a restaurant, that would be the thing that I would try to limit and then go back to that whole food. And then again, as far as beverages go, we don't have enough data to say, well, the color blue in a blue sports drink is not good because of the chemical that's in there. But of course, consuming, again, anything that's minimally processed and doesn't contain a lot of sugar. Remember, I mentioned processed sugars tend to be more pro-inflammatory. So if people are drinking a lot of sodas and punches and sugary sweetened beverages, those should be limited. And then unsweetened beverages would be a priority.
Thank you. For you, Dr. Carriere, how do I connect with the MS community when I live in the middle of nowhere? I live in a rural community. I want to find the support that you were talking about, but it's hard to connect when I'm not even sure if there is someone else in my community that has MS or really understand what MS is.
Good question. Social connections, peer connections can be so incredibly powerful. But that can be a challenge when you're living in a rural area and you may not have convenient ways to meet others and connect. So one thing to think about is that role of virtual connections, starting with the websites for MSAA, the National MS Society. Those are places that you could start with to get you connected, as they are patient advocacy organizations, and can give you that information of what types of groups may be occurring either locally or on a national level. With COVID, we've been able to transform so many different in-person activities to virtual, which can fit for a lot of people and can give you that access. So location may not be so much of an issue with the virtual connections.
Thank you, Dr. Carriere. Dr. Kruskall, can you get vitamin D wearing a sunscreen?
Actually, no. Unfortunately, when you wear sunscreen, it does block both the UVA and UV rays, so it does prevent your body from making vitamin D.
Okay.
However, I guess I can add to that too. I mean, if you look at what it takes for healthy vitamin D, going out in the sun, exposing your hands and your face for 10 or 15 minutes a day would help people make vitamin D. And for individuals that are already vitamin D sufficient, that would help them to maintain. But again, we always have to balance with time in the sun versus using sunscreen to prevent. So if you're in the sun but using sunscreen, I would make sure your vitamin D levels are assessed, and getting it in the diet would be very important if you're a regular sunscreen wearer.
Thank you. Going back to you, Dr. Kruskall, how much biotin should we take, if any at all?
Okay, looking at the research of biotin and MS, and I didn't get to touch on that tonight just because of the time constraint, but there is some research underway looking at biotin, because we do need biotin to help us manufacture our nerve cells, and it actually kind of serves as a fuel for our nerve cells. And just to put it into perspective for you, healthy adults need 30 micrograms of biotin per day. So that's what we all need. And if you look at some of the research studies that we have on biotin in individuals with MS, that they're taking 100 to 300 milligrams per day. That's hundreds of times more than what we would consider is the dietary reference intake. So that would be considered mega dosing. So there's not enough research to say that everybody should be taking this mega dosing amount of biotin, but it is something that we should be talking about with our physicians, making sure that if for some reason we're looking at the biotin in our diet and we're not getting adequate amounts in our diet, a physician may recommend taking more, but we don't have a one-size-fits-all that all patients with MS should be taking extreme amounts of biotin until we get more research.
Thank you. A couple more questions for you, Dr. Kruskall. Could you please tell us what we should consider regarding caffeine and alcohol intake?
Sure. As far as caffeine goes, there's not a lot of research on either one, by the way. So it's not that we have an abundance of research on how caffeine impacts MS physiology. But in general, for health, if people are consuming less than 400 to 500 milligrams of caffeine per day, that would be beneficial for health, or would not basically cause any problems with health. It shouldn't exacerbate any issues with cardiovascular disease. And to put that into perspective of, what is less than 400 to 500 a day, a cup of coffee is about 150 milligrams of caffeine. A cup of tea, depending on the kind of tea, might be 50 to 75. A can of cola is 35 milligrams of caffeine. So in general, kind of keeping it with that recommendation, if you're consuming less than 400 to 500 milligrams per day, shouldn't be any exacerbations of MS symptoms. And then as far as alcohol, as far as a dietitian, I'm going to give you the dietitian's perspective. Some forms of alcohol, in the form of, for example, red wine in small doses, might be beneficial for some health conditions as far as a cardiovascular protective effect. But that doesn't mean if you don't drink, you should begin drinking. That's one thing I never recommend for somebody. But if you're drinking within moderation, and again, if that's 1 drink a day for a woman and 1.5 to 2 drinks a day for a larger man, and it's done healthfully, there should not be any exacerbation of MS symptoms when you're drinking it in those quantities.
Thank you. This question is for both Dr. Rensel and Dr. Kruskall. We were taking 4,000 IU of vitamin D daily. Our neurologist mentioned that new data is saying that MS patients should take the usual dose of vitamin D, such as 1,000 IU. Why the discrepancy?
I'll
start.
Okay, I didn't hear the question. I got confused on the numbers. Yeah, you go ahead, Dr. Rensel. You go.
Okay.
Yeah, so I think like we've already talked about, is that there's some controversy with medical studies, right? So one study may say, oh, it looks like if you have a low vitamin D, you may have a higher risk for MS, and another study will say, oh, that didn't really show it that strongly. So I think that's where some of this controversy came, is there was a larger vitamin D study, and it was not strongly positive that it affected the outcomes of MS, meaning MRI or new symptoms. So I think that's why folks said we better back down a little bit. You don't have to go as high as you thought, and that there may be a risk of very rarely of something like calcium imbalance, like a kidney stone. But so if you go too high, so that's where that came from. There was one large study. It did not seem to be like a treatment for MS, So we always want people to be on their disease-modifying therapies because the science is the strongest behind that. Yeah, we'll see. Dr. Kruskall, what would you add?
Oh, I would say the same thing. And again, it's not that, I just always want to point out, it's not that physicians are flip-flopping or changing their minds. I get accused of that frequently. Dietitians are always changing their minds. As Dr. Rensel said, our science is evolving. So if you were someone recommended 4,000 IUs per day, and then again, that study that was published in 2019 showing us that, maybe supplementation doesn't necessarily have the outcomes that we thought. So let's back off a little bit. It's not that we're changing our minds. It's that the science is evolving, number one. And then number two, we really need to see how the patient is responding. There are patients that can be taking very high doses of vitamin D and their blood levels don't change much. And then other patients could take a nominal dose of 1,000 or 2,000 IUs per day and see a huge improvement. So it does need to be very individualized to the patient as well, not just as a broad guideline.
Thank you. So we have about 6 minutes or so left. So I wanted to ask each of you any key takeaways from tonight's presentation that you can share with our viewers.
Do you want me to start? This is Laura Kruskall. Okay, I'll start.
Okay.
So just as I started my presentation, for me, again, as a nutrition scientist and as a dietitian, nutrition is a very young field and a very young science. Physics and chemistry and biology have been around for many, many years, and nutrition is very new to the block. And the science that we have to establish guidelines is also new. And as I said a few minutes ago, the science is evolving and ever-changing. So when we make recommendations regarding nutrition, sometimes they are going to change over time. As we get better science, we might fine-tune those guidelines. And then there are other times where I can't give a guideline or a specific recommendation, just like the question with caffeine and alcohol. We don't have an abundance of studies looking at caffeine and MS physiology. So sometimes we don't have the science at all to answer those questions. And then the second thing I wanted to highlight is even though the science that we have is limited and there are lots of different, again, diets being studied, and I know many of you have heard of things like the McDougall diet or the ketogenic diet or the Swank diet or intermittent fasting and the Mediterranean diet. There are many, many, many what we call diets on the market, but most of the evidence that we have thus far really support the anti-inflammatory eating pattern, which is that Mediterranean style. And the visual I will leave without getting into specific numbers is that if you can envision your dinner plate, if half of that plate can be coming from plant foods, an abundance of vegetables with some fruit incorporated, a quarter of your plate with lean quality protein, and a quarter of your plate a quality carbohydrate, that would be considered a balanced meal without having to even get into any numbers, just to have a nice visual there.
Thank you, Dr. Kruskall. Dr. Rensel, Dr. Carriere?
Yes. Yeah. So, thanks everyone for putting up with no slides. I appreciate your patience. When we talk about transition care, it's such a process. So we really need to think about it even when the patients, the people, the kids living with MS, the teens living with MS are only 12. So it's a process. It goes all the way from 12 to young adulthood, all the way up to, 25. So just like anything, when we're learning something new, learning one new thing each visit or one new thing each year will help the young adult, that will help them turn into, adults that they feel autonomous, they feel independent, they feel like they have power, or a term is called self-efficacy, like they know what to do in the doctor's office, they know what to ask and what to expect, and they know how to navigate. Medicine is a tricky environment to navigate sometime on who to call and when to call, and those are all very fair questions to ask providers. So I just want to acknowledge that it's a long transition from age 12 all the way up to 26. And to look at that website on gottransitions.org, it has a lot of nice handouts even for caregivers and teens and young adults to help walk you through it and give you some ideas of how to go through this journey. So all the best to everyone.
Thank you so much, Dr. Rensel. Dr. Carriere, any last thoughts?
Hi, yes, thank you, Marie. From my perspective, when in thinking about the journey of the care partner, or the support partner, it's really kind of recognizing their role. So often when you are living along someone with a chronic illness, your focus is always on the person with the diagnosis, right? How can I be supportive to them? How can I take care of them? And that's an important piece, and those living with the disease are so quick to say, I recognize that support, it's pivotal. We also need to be mindful of what the support partner's journey looks like. What are their needs, right? We want to recognize that you're going to have needs. You're going to have evolving, changing needs over the course of this disease. And so we want to be able to recognize that, pick up on those warning signs, recognize when a little bit more support may be helpful. And also, too, you may not know what you need, but you may know and recognize just something doesn't feel right. But help's available, whether that be through somebody that can help with addressing the emotional symptoms, or if it's caregiver-specific related concerns, we can help with that. Your healthcare team can really be your first place that you start to help you navigate what it is that you need, what are the difficulties you're experiencing, and really align you with the resources that best meet those needs. It's really the best way to optimize your trajectory, because we need you to be just as well as your partner is and tending to them. It's all about the partnership. And oftentimes it's not perfect in terms of a 50-50 partnership, as we often like to say, but can we work towards where you as a support partner feel supported?
Wonderful. Thank you so much, Dr. Carriere. This concludes, on behalf of MSAA, we would like to thank Biogen, Bristol Myers Squibb, Genentech, and Novartis for making this program possible. We would also like to thank Dr. Rensel, Dr. Carriere, and Dr. Kruskall for their great presentations, as well as our partners at Impact Education in delivering this program. This concludes our Health Promotion and Wellness in MS series. Tonight's webinar was recorded and will be made available on our website at mymsaa.org. There you will also find information pertaining to the COVID-19 and MS Pathfinder online tool, providing information about the ongoing COVID-19 pandemic. Our next webinar, entitled Mind, Body, and Spirit, a comprehensive overview of wellness in MS, will be held on September 22nd at 8 p.m. Eastern. Please visit MSAA's calendar of events for our upcoming webinars. I would also like to thank you for joining us this evening. Please consider completing a brief survey that immediately follows this slide. Please know that we are thinking of the entire MS community and hope that you and your families continue to stay safe. Thank you and have a good night.